really we wanted to put this panel together to discuss and kind of just, hear about how other people are performing in their APP roles in different places around the country and in different either urology or urogynecology disciplines, and also in different settings, academic settings versus private practice.
So it's my task to start with giving you a little bit of information about sort of what it's like working in an academic practice. We have sort of an 80-20 structure. So we're 80% of the time clinical, and then 20% of the time is our focus time for our academic endeavors, whether that's research or other administrative tasks, depending on what committees we're on, what we're doing from an educational standpoint to educate our nursing students, our nurse practitioner students, our medical students, our residents, and our fellows. So my faculty tract, my faculty appointment is through the medical center and the medical school. Even though we have a School of Nursing program, that's not where my faculty appointment lies, which is a little bit different from other advanced practice providers who are faculty at their schools of nursing. So I am in charge of my own patient population, my own patient load. I pretty much take care of all of the conservative management for our patients. So anyone who's not going in a surgical direction, I'm going to get those patients. Patients who are going in a surgical direction, I'm doing a lot of the work to help get them ready, whether that's the urodynamics, making sure that we have up-to-date pap smears, making sure that we do all of the evaluations that might be necessary before we can get them to the OR. And then I manage a lot of them post-operatively. So I see all of the patients in the very early post-operative phase, and then the surgeon sees them typically at 6 weeks and 12 weeks post-op. And then again, I get them from there. I take care of all of the pessary management, do the pessary consults, manage a lot of our medication patients for their OAB or their painful bladder syndrome or their recurrent urinary tract infections, do a lot with tibial nerve stimulation, keep a good eye on our interstem patients. We do have prescriptive authority. I do have a DEA number. I write my own prescriptions. I don't require a co-signature.
So we do see a wide range of everything urology. I work in the outpatient setting, so I have my own autonomous clinic, and I also work in the operating room. So one day a week, I have my designated OR day, and that day for me is Wednesday. When I'm in the operating room, I'm first assisting on robotic cases, and those cases are robotic sacrocolpopexies, prostatectomies, cystectomies, partial nephrectomies, pyeloplasties. Those are the big surgeries we generally do. Basically, as a PA, we provide medical services that are delegated by the physician, supervising physician within my education, training, and experience. So the things that we do in our practice, we do pessary fittings, posterior tibial nerve stimulation, hydrocele aspiration, cystoscopies, both diagnostic and therapeutic, prostate biopsies, fusion biopsies, testapel, penile injections.
I had actually been in urology since I graduated from nursing school way back in 1982. So urology has been my area that I've loved for a long time. So the type of patients I do see new patients. I see all of our advanced practice prostate cancer patients. I see the urgent PC, the urgent PC patients or PTNS patients. I see on the first visit, evaluate them for appropriateness for the treatment, and then I see them on the last visit to see if they have responded. In between, a nurse does the treatments with them. We have a very busy research department in our office, and I'm very involved with that. A lot of that is prostate cancer research, although we are doing a lot of bladder cancer research now. So I do the physical exams, any complications or side effects that the patients might have, I'm dealing with them. I'm screening patients for clinical trials. And so I'm just another resource for our clinical coordinator in research to come and ask questions as you know, if you're working as APPN in urology, your patients are different than the urologist patients. I mean, the urologists have a lot of follow-ups, you know, prostate cancer follow-ups or surgery. We have a lot of fill and pulls, retention, treatments, things like that. So it can get very busy for the nurses that work with us. I've grown my practice through the years by starting as a family nurse practitioner, and I had all of those contacts. As I've gone through the years, because I was a family nurse practitioner, I knew about osteoporosis and bone health. So with our androgen deprivation patients, it was a natural fit for me to develop a bone clinic, because I knew all the medications. I knew what I need to teach them. So I developed the bone clinic. I saw our ADT patients. And then as we started getting more medications for prostate cancer, I've just kind of fallen into the role of the advanced prostate cancer clinic in our practice. So it's me and one physician that does this.
The planning committee asked me to talk about my experiences as an entrepreneur, as having my own company. Next. So what is it? I guess I wanted to start and just help you with a few little things. And one of them is, what is it right for me? Is it right to be an entrepreneur? Can I handle this? And part of that is, before you take that plunge, is to ask some questions of yourself. And when I looked at this, I went, oh boy, did I really ask these questions of me? But do you have above reproach clinical skill set? Leanne really talked a lot about that. And it's an exceptional high energy level and a fiercely independent propensity to succeed. How do you like that one? It just means that you have to have a lot of stick-to-itness, and you have to be sure in what you know. You must also sort of gain some business skills. And that was something, I have to be honest with you, I wasn't real good at, and I just relied on everybody that I could to help me with that. But we really have to convince the decision makers, wherever you're going as an entrepreneur, that, yep, this is okay for them. You know, convince them that this is a new way of reaching a goal. This is a new way to provide care to your patients, that there is a data-driven, clear advantage for patients and for the organization. And in the finish here, this is why I did it. Okay? If you look at these faces, you can see the love that you see from each one of them. And that's why I did it.